So please, if you would, as the panel exits, allow me to introduce our next speaker. But please, take a second more standing if you want. That's enough. Confirmed by the Senate on January the 20th, 2009, as our 30th Secretary of Agriculture, Tom Vilsack is now the longest-serving member of our President's Cabinet. He's the third longest-serving Secretary of Agriculture in our history. And if, as things proceed as I expect at least, he will soon tie for second the record of Ezra Taft Benson, I'm not sure that I recommend that he tie James Wilson's 16 years as the Secretary of Agriculture, but I do believe that he will soon be tied for the second longest-serving Secretary of Agriculture. He chaired the first White House Rural Council and now leads the response to the rural opioid crisis on the President's behalf. There is a story on the front page of the Washington Post today, and in fact, it's most of the front section of the Washington Post today describing the work that he's doing on behalf of us all for the President. He's been a partner with the First Lady Michelle Obama in the Let's Move campaign. He advanced historic investments in farmers markets and local food infrastructure. He was the mayor of Mount Pleasant, Iowa. He was a two-term governor of Iowa. He was a leader in the Iowa State Senate. He was, for my purposes, at least equally importantly, a senior RA at Hamilton College when I was a freshman, and I ultimately became a sophomore, for which my parents and I will always be very thankful. Vice President Joe Biden, acknowledging his own longevity, called him the single best Secretary of Agriculture. There's nobody that's been his equal. He actually knows how to get things done. Please join me in welcoming our Secretary of Agriculture, Tom Vilsack.
Thanks, folks. Thank you. Well, it's not surprising that the mayor would focus on my time as mayor of Mount Pleasant, although he was mayor of a much larger community. But I am just a little bit disappointed that maybe I missed it, that you didn't talk about our time together at Harvard, which is why I'm here. Bill gave me the opportunity, the great privilege of being a fellow at the Kennedy School Institute of Politics when he was the executive director there and was leading the effort, and one of the great experiences of my life. Had a wonderful time there, and certainly appreciated his leadership of that effort and the friendship that we've had for an extended period of time. And I want to thank you all for being incredibly interested in an issue that requires a lot of time and attention. The obesity issue is one that certainly impacts and affects many, many Americans. We at USDA are concerned about it. We're particularly concerned about it as it relates to our young people. If you look at those who are obese or at risk of being obese, it can be as many as a third of the youngsters in this country. And I want to talk to you briefly about what we have been able to do at USDA and what we're continuing to do, and what I'm confident will continue. Early in the administration, we began the process of finalizing the improvement to the WIC program. As you know, that's a program that impacts and affects about half of all of the youngsters 0 to 5 in this country. We work with pregnant moms, we work with newborns, we work with young parents to encourage them to embrace good nutrition from the get-go. And what we do with the WIC program and what we have done with the WIC program was to change the composition of what folks participating in that program could have access to, the WIC package, if you will. We wanted to put a focus on fruits and vegetables that would not normally be purchased by families, the kinds of opportunities to expand the tastes, if you will, of youngsters early in life. And that was one of the first things that we did. We then focused on school-age children. And there, the Institute of Medicine was quite clear about the concerns that they had about school meals. They basically identified that we had too much fat, too much focus on calories, too much sugar, too much sodium, ways in which we were not really seeing a healthy mix available to our youngsters. They strongly suggested that we have more fruits and vegetables, more whole grains, and more low-fat dairy. So we began the process of encouraging our Congress through the Healthy Hunger-Free Kids Act to give us the authority and the power to change the mix, to eliminate the fat and the sodium and sugar, and substitute for those things foods that would be more delicious and more nutritious. Not an easy fight. But over time, we now have seen 97% of school districts in this country basically following the new guidelines. Those school districts that were having a difficult time for whatever reason, perhaps it was economic, perhaps it was that they weren't quite sure how they could access the more fruits and vegetables, we created a thing called Team Up for Success, where we reached out to those school districts that were struggling, and we matched them and paired them in a number of states with school districts similarly situated to provide a mentoring experience, an opportunity for those succeeding schools to help those who were struggling. And I think that's been helpful in getting more schools to embrace the new nutrition standards. We also provided an opportunity for schools to look at their vending machines and the snacks that were available to make sure that we were sending a consistent message at the school. If we were going to serve more fruits and vegetables and whole grains and so forth at the mealtime, then we obviously had to make sure that we reinforced that message with the vending machine options that young people would have. School districts were initially concerned about that because that is a source of revenue for many schools, but it turned out that kids will buy what's in the vending machines, and they are more than happy to buy flavored water, low-cal sports drinks, low-cal sodas, things of that nature that would substantially reduce the exposure to calories, to sugar, and to sodium. That allowed us to begin focusing on the marketing that takes place in schools, again, in an effort to try to remain consistent. We wanted to make sure that there was not a counter message in terms of marketing, so we're working with school districts to make sure that whatever advertising, whatever marketing takes place for youngsters in the school setting is very consistent with the new standards. Now, the good news is we've seen 16% more increase in vegetables, a 23% more increase in fruit consumption. We have worked with Cornell and other universities to try to come up with strategies to encourage smarter lunchroom choices for young people. The way in which food is displayed, the way in which it's named, who serves it, how it's served, sharing tables, things of that nature designed to provide an opportunity for school districts to look at innovative ways to make school meals more nutritious and more appealing. We've invited chefs into the schools from local restaurants to work with food personnel. We've had nearly $200 million in school grants that have been provided to schools through state ag departments and state departments of education to expand equipment. Many school districts had changed to a centralized processing facility. We wanted them to get back to potentially producing food on site, so we are providing them grants for large-scale equipment. And we have an interesting relationship with the National Football League and the dairy industry of this country. They have supplemented our $25 to $30 million grant program with an additional $5 million, which is focused on small equipment purchases for schools. So all of that, I think, has gone well. We wanted to identify for ordinary folks what a nutritious plate looked like. Candidly, and this is the honest to God's truth, I looked at the food pyramid. I knew that as the Secretary of Agriculture, no doubt somebody would quiz me on the food pyramid. I studied it. Yeah, I spent time at Harvard. I should have been able to figure this out. It was too complicated. So we went about changing and making it simpler and easier to understand what a nutritious plate looks like. Half the plate fruits and vegetables, the other half carbs and protein, with dairy on the side. The My Plate effort has been, I think, incredibly successful. There has been a lot of effort on our website and on choosemyplate.gov to give people a better understanding of what a nutritious plate looks like, and we're seeing that being adopted. We're seeing the visits to our website increase dramatically. We think it's a much easier way of explaining to people precisely what a healthy plate looks like. We then focused on our nutrition assistance programs, the SNAP program. And one of the things that we looked at was whether or not incentives to encourage SNAP families to purchase more fruits and vegetables would in fact work. We had a long-term longitudinal study at Mount Holyoke in Massachusetts for a couple of years, where we basically worked with grocery stores to provide incentives, the ability to stretch a SNAP, the Supplemental Nutrition Assistance monies or card, to extend that in the event that individuals would purchase a certain number of fruits and vegetables. And what we found from that study was that, in fact, incentives work. And so we encouraged the Congress in the 2014 Farm Bill to create what we refer to as the Food Insecurity Nutrition Initiative, FINI. It's roughly $100 million. About $50 million of it has already been allocated to states and to projects within states to encourage SNAP beneficiaries to receive the ability to buy more fruits and vegetables, more fresh fruits and vegetables. We work with private foundations and the nonprofit world to try to match our dollars with their dollars so that double buck campaigns are encouraged. The ability of folks to go to a farmer's market, redeem their SNAP benefit. They spend $5 of SNAP benefits, they get $5 of nonprofit assistance and help that allows them to purchase up to $10. We're looking at ways in which we can make those farmers market experiences more readily available to SNAP families, and so we have invested in expanding EBT, the electronic benefit transfer systems. What was available at about 1,000 farmers markets today is now, as a result of this administration, available over 7,000 farmers markets. And we're continuing to look for ways in which we can expand access for SNAP families. We also have worked to expand the number of farmers markets, and we've looked at the issue of food deserts. The reality is that for many who are living in persistently poor areas or remote areas, they may not have access to a full-scale grocery store. So we work with our partners at Health and Human Services and at the Treasury Department using grants from HHS, the new market credits from the Treasury Department, and our assistance at USDA to encourage the development and the financing of full-scale grocery stores. To the extent that we can't get it done through our programs, we're using the bully pulpit, if you will, asking grocery chains to consider their social responsibility of making nutritious food available. My favorite story in that space is the work of Whole Foods. We had a series of ministers come to us from Detroit, from inner city Detroit, very concerned about the health of their congregation, very concerned about obesity, very concerned about diabetes, very concerned about the chronic diseases that follow youngsters who are obese in childhood into adulthood, and the tremendous expense from health care and loss of productivity that carries with it. And they demanded from us something, help and assistance. So I called the folks at Whole Foods, a friend of mine called Walter Robb, who is one of the co-CEOs. And I asked Walter what Whole Foods was doing about inner city access. To his credit, he sent a team to inner city Detroit, and they came back and they said, well, we could try our usual program, and our plan, we'll see how it pencils out. Well, no surprise, it didn't pencil out. And the team advised Walter of that, at which point Walter said, well, let's figure out a new plan, a new way to address the issue here. What could we do to make it work? Well, they downsized the store a bit. They surveyed the neighborhood to find out precisely what they needed to offer. And then they decided to go forward with a opportunity in inner city Detroit. They decided to provide job opportunities for people in the neighborhood. They decided to have nutrition classes at the store, hiring local people, providing local folks recipes and things of that nature, and they opened the store. They had a series of 10-year sales projections, which they thought would define for them success or failure of this effort. They were surprised, I was surprised, I think we all surprised to find that they met the 10-year projection in the first year, which led them to believe that this was something that they could do in other cities. They went to just outside the 9th Ward in New Orleans. They went to in New Jersey to Newark. They were invited to Chicago They were invited to Chicago by Mayor Emanuel, who wanted them to talk about the possibility of locating stores or a store in areas where there had been significant gun violence. Pretty significant risk. They are opening a store, it's either this week or next week, I think, in Chicago, in the neighborhood with the highest gun violence rate in the city of Chicago. They not only encouraged themselves to do this, but they also reached out to Starbucks, to Chipotle, to create a series of stores in this neighborhood. And I believe over time that will transition and transform that neighborhood because it will create opportunities for employment. It will create opportunities for people to have access to good quality food. And they were able to structure the program at these new stores in a way that the food was more affordable, if you will, than a traditional Whole Foods store. So a tremendous opportunity, and now they are looking at some of the areas in Baltimore that were involved with some strife a couple of years ago. They're looking at ways in which they might be able to provide help and assistance in that neighborhood. But we're not stopping there. We're also asking those stores that are located in those remote areas, those stores that are currently providing food in the form of convenience stores, we're asking them to rethink how they stock and shelve what they sell. Now, this is a controversial matter, and it's in the process of being worked on at USDA, but the gist of what we're attempting to do is to look at ways in which we can ask and require convenience stores that are redeeming SNAP payments or redeeming SNAP cards, which is oftentimes a significant part of their business, that in exchange for the ability of the federal government to help that store with their customers being able to afford items, that they stock a broader array of more nutritious choices. They stock more choices within each one of those main food groups, and that they provide enough quantity that would be able to meet on a fairly regular basis the demand of the area. So we are aggressively working in that space to try to deal with the issue of food deserts. We've mapped the country so that we have a better understanding of where those food deserts are located, and we continue to work with Congress to ask them for additional resources to assist us in providing grants and incentives to locate grocery stores in these neighborhoods. The last thing I want to talk on in terms of what we have done at USDA is to talk about the research that we're doing. And we're doing a substantial amount of research in terms of choices that people make and how we might be able to encourage and incent more effective choices. There are many who would like to see us be more restrictive in terms of what SNAP families can purchase. There are some who want to do this just because. There are some who believe it will lead to more nutritious choices. There is a challenge with that notion. And part of the challenge is making sure that we don't go back to the day where we stigmatize those people who are on SNAP. There was a day not long ago where individuals in a line at a grocery store would be able to easily identify those people on SNAP. Just in the same way they were able to easily identify people on school lunch. And the challenge with that, of course, is that then those folks are judged, they are embarrassed, and it creates an impediment. So we have made a real concerted effort to try to bring everybody together so that what SNAP families are doing looks just no differently than what the rest of us do with a Visa card or a MasterCard. There are some technological challenges. Grocery stores in the United States offer roughly 300,000 separate products. And there is, how do you distinguish from one product to another? Those who want to reduce sugary drinks often think of them in terms of sodas, but the reality is the definition would also cover things like apple juice and orange juice. And I'm not sure how many folks really, truly want to exclude families from potentially purchasing that. And so we're trying to work through that process and trying to work through how we might be able to more effectively make sure that people are empowered to make the right choices and are provided the information to make the right choices. So through research, And through our SNAP education program, we're trying to provide information to SNAP families so that they make informed choices, so that they're in a position to understand that fruits and vegetables don't necessarily have to be more expensive. You know, we've done an interesting research project on that in terms of how we characterize or how we evaluate fruits and vegetables. In the past, you would value it based on a 100-calorie portion. So you would say, how much is 100 calories of potato chips and how much is 100 calories of broccoli? Well, 100 calories of potato chips would be about the size of this little buzzer thing here. 100 calories of broccoli probably fill this room. Naturally, the broccoli is going to be more expensive. But what we really ought to be doing is we ought to be gauging it on portion size. And I can tell you, depending upon the type of potato chip we're talking about, there's a potato chip from Iowa called the Sturgeon's potato chip. There's no one in our family that can stop at a handful of those potato chips. They're going to eat the whole bag. That's a portion size for some in my family. That's pretty expensive when you compare it to a portion size of broccoli. And so part of it, the effort is to try to redefine how we characterize cost so that we sort of make it easier to understand that fruits and vegetables don't necessarily have to be more expensive. We're also providing some help on the form of recipes on our website to give SNAP families the capacity to figure out how to incorporate more fruits and vegetables, more whole grains, more of the more nutritious options into their diet without breaking the bank. And I think the overall effort here, I think we're beginning to see some small steps, small signs that we're beginning to have an impact. Some of the obesity rates have plateaued, especially among children. And for a subset of kids, they have actually gone down a bit. You know, obviously the kids in schools are eating more fruits and vegetables, and I think, you know, if we give this effort a generation or so, we're going to see, I think, significant changes. That's why it's important for us to work to ensure that Congress reauthorizes the programs that we have just talked about, that they don't miss the opportunity to sort of cement them, if you will, in our nutrition philosophy and our nutrition approach in government. Right now, we're dealing with that effort. We have a great advocate with the First Lady and her Let's Move initiative. We want to make sure that we finish strong, if at all possible. So we're going to continue to work with Congress to try to get that done before this administration is over. We're also going to make sure that our partners in all of this, whether it's the school nutrition folks or the hunger advocates, are continuing to work and encourage a continuation of these programs. We're seeing food insecurity decline a bit in the United States, and the good news is we've seen particularly important decline among children based on the time that we've actually been recording this. It's at a record low this year. We're proud of that. We want to obviously see that continue. So there's been an awful lot of work done over the last 7+ years. It's something that I think those of us associated with USDA and associated with this administration are proud of. We think if we stick with it and stay with it, we'll see more significant benefits over time. But it will take time. We didn't get into this situation overnight, and we're not going to get out of it overnight. What's ironic to me is that when I was a young person, we had just before I was born, instituted the school lunch program because President Truman at the time was deeply concerned about the country's inability to have enough healthy people to be able to defend the country. He felt that there needed to be more calories consumed by young people so that they would be physically strong to be able to defend the country. Now, in a lifetime, we now see admirals and generals being concerned about the future of our military based on the fact that there are too few people to choose from in a volunteer army. So we've come a ways, if you will. Obviously, there's got to be more physical activity. That's why we've teamed up with the National Football League for the Fuel Up to Play 60 with the dairy producers to encourage kids not only about what calories go in it, but also the calories that go out in terms of physical activity. So it's a holistic approach. It's a comprehensive approach. It's sort of cradle to grave approach. And I think it's one that needs to continue, and I think if it does, we're going to prevent a substantial amount of unnecessary healthcare expense, illnesses and diseases, and lost productivity. We're going to probably protect a lot of young people from the ridicule that from time to time occurs when someone is overweight. I know that something I experienced as a kid growing up, that those memories still stick with me, being made fun of in school because of my size. So we are very sensitive to this, and we really appreciate the fact that you're focused on this and obviously working to expand prevention, expand treatment, and make sure that we have a healthier nation. All right? Thank you.
Question or two? Eduardo Sanchez, doctor, Texas.
Eduardo Sanchez, I'm the Chief Medical Officer for Prevention at the American Heart Association. Thank you so much for being here, and thank you for your leadership and all you've done to move the needle, many needles, in the right direction. There are some who say that if we could get all Americans to eat the fruits and vegetables that are recommended as the daily requirement, we don't have enough fruits and vegetables to get us to that place. Can you talk a little bit about how we go from where we are to increasing demand, increasing production, and moving distribution to more people?
Well, I think there are two responses to that question, and it's a good one. The first response is the expansion of local and regional food systems, which I think is particularly focused on specialty crop production, and in many cases organic specialty crop production. We've seen growing interest among young people to get into farming, and many of those young people are interested in fruit and vegetable production. So first and foremost is investing in that system for multiple purposes. One, because it expands the supply of fruits and vegetables, and we've looked at a wide array of microloan system that didn't exist before that now does exist to create an opportunity for young people to get started small. Expansion of hoop houses, which are grants given to folks to extend the growing season in parts of the country where you may have a harsh winter, but you're still able to produce. The development of an urban farming toolkit that says, hey, you don't have to just do this in a rural area. You can do it, you can do it just about anywhere. You can do it on a roof. You can do it, I've seen that in a number of places. You can do it in a small commercial-sized lot that you're reclaiming from an inner city. You can do it with a community garden effort. We also have the People's Garden program, where we, in honor of President Lincoln's 200th birthday, which was 2009, we sort of converted an asphalt parking lot at the USDA headquarters at 14th and Independence to a little organic garden. That has spawned over 2,100 gardens of that kind, which are producing fruits, vegetables, herbs, and so forth that are now going to food banks. There is also the issue, and today's been a sort of a food day. Earlier this afternoon, I talked about food waste at the Feeding America conference. A third of our food is wasted. So if we could cut down significantly on food waste, there would obviously be greater supply. And there's no reason why we can't do that by reducing portion sizes. And I encourage the folks at that Feeding America conference to think about the power that we have as individuals. Not just in our homes, but you go to a restaurant, and you know you're going to get more than you can eat. And I've begun to basically say to the waiters and waitresses, hey, here, I know I'm entitled to fries, but I really don't need 5 pounds of fries. I just need a handful. And I'm happy to pay whatever I need to pay, but I just don't want to waste food. And you make people more sensitive on that score. So I think you can increase supply by increasing what's grown domestically and by reducing food waste. And then there is the issue of trade, the ability to bring fruits and vegetables in. You know, I know there are some growers in our country that are worried about this. They're deeply concerned about market share. But here's the, here's the news. In our lifetime, the chances are pretty good, or at least in your lifetime, the chances are pretty doggone good that we're going to have 9 billion people on this earth. To feed that many people, we're going to have to increase productivity, food production worldwide by an astronomical amount. Most conservative estimate I've seen is 50%. The highest range I've seen is 70%. That's going to require an enormous amount of productivity that doesn't exist today. So there's going to be demand. There's going to be huge demand. And I think if we can understand that, then I don't think we see, in terms of long term, we don't see quite the threat, because there's going to be a lot more people consuming the fruits and vegetables that are being produced. So there's going to continue to be that demand that will allow us to have stabilized markets that will be able to support those who are in the fruit and vegetable production. On the distribution side, what we are doing is, you know, we're trying to create new consumers through our school programs, but we're also trying to create new purchasers by acquainting school districts with what's grown and raised in their vicinity, in their area, through farm-to-school grants. We've done almost 300 of those. And we're now dealing with millions of kids who are engaged in school districts that are purchasing local foods, fruits and vegetables and other foods that allow the school district to make the case that we're keeping money in the school district and we're supporting our farmers. It also creates a better link between rural and urban, between taxpayers and tax receivers, and it creates, I think, a stronger sense of community. So I think there are strategies, and there are strategies to build out the supply chain. We have what are called value chain coordinators now that have been funded in part by nonprofit entities and USDA in a collaborative effort to better link up the producers of the food with the consumers. And the last thing I would say is we continue to look for creative ways, and one thing that could help us with the production of more fruits and vegetables is immigration reform. Now, you might be surprised by that answer, but the reality is that there is a lot of acreage in this country today that is not being farmed, or if it is being farmed, it's not being harvested, or if it's harvested you know, at a very late stage, because we don't have a stable, secure workforce. Despite the best efforts of producers to make, you know, wages and so forth good, there just aren't that many people willing to do that work. So immigration reform would create folks coming out of the shadows, create a stable and secure workforce, which would make it easier for farmers with acreage to make a determination to plant those acres, and it would certainly make it easier to ensure that whatever's planted is actually harvested. Because with fruits and vegetables, if you don't have the workforce at the time that the fruit and vegetables are ready, you're out of luck. So there are a whole host of things that can and should be done, but I think at the end of the day, we're going to eventually get comprehensive immigration reform because we have to. We're eventually going to have that better connection between consumers and suppliers. We're going to have a whole generation of new farmers, big and small, and I think we'll be able to meet the demand, and if we can't, we obviously have trading relationships. Anything else? All right. Thank you all.